Thanks so much, Mark. President Trump has made healthcare a central focus of his administration, working with lawmakers and drug companies in an effort to bring down healthcare costs. And joining us now to discuss what every Medicare beneficiary needs to know before the deadline fast approaching is the man heading up the program, Dr. Mehmet Oz. Good morning to you. Thanks for joining us.
Thanks for having me on, Jan. Since you teased it, let me just make sure everyone gets the key message out there. You've got till Sunday, if you're on Medicare, to take advantage of the open enrollment period. Remember, this program is the crown jewel of our social safety net program. Almost 70 million Americans are out there benefiting from Medicare, but you once a year need to sign up to make sure you're on the right program, that your doctor's included, you have the right medications paid for. You can save hundreds of and thousands of dollars, but you got to go to Medicare.gov. It's the official source of all healthcare information around Medicare. If you don't want to talk to a computer, you can talk to a human. Just go to 1-800-MEDICARE. Either way, you'll get information that can be life-changing and certainly save a lot of money.
What happens if you miss the cutoff?
Got to wait till next year. It's a long time to sit around wondering how much money you could have saved if you just go on the Medicare.gov. Jen, the other thing is we spent so much time trying to make this wonderful source of information work better. We put all kinds of tools in there for plan finders to make sure that you know that your doctor's in the plan you're looking for. We have all the prices more clearly stated. We can make sure your medications are covered so you don't pay too much out of pocket there. And Medicare changes every year. This year we drove down costs for some of the prescription drugs, but we're paying more for some other parts of the program. So you've got to rebalance it every year. It doesn't take a lot of time. You can get some family with you if necessary. And again, if you don't like doing it on a computer, you just call 1-800-MEDICARE, but it's there for you. You own it. You paid into it. Take advantage of it. But if you don't do it by Sunday, you're going to have to wait another year and you'll be throwing money away.
And that, again, is December 7th, just days away at this point. What are some of the biggest changes enrollees should look for when they do compare those options?
Well, we want to have you sign in, because if you sign in, we know more about you. We can give you more educated advice to customize the program for you. So the same way you go on a computer, you can use your fingerprint to open the computer. You can do that to identify yourself on Medicare.gov. We've got tools, even facial recognition to make it easier as well, or make a password. The same kinds of systems that we have historically been trusting to identify that you're who you are when you go through airport security. We're starting to develop those, again, simply to identify that you're the person asking the question so we can give you customized advice. Because everyone's on different medications. We all have different ailments that might actually cost us some money. We have different doctors. We live in areas that might be better for one plan versus another. So, I wish it was one size fits all. Medicare itself is a fantastic program, but you do need to customize it.
And a lot of seniors are on fixed incomes and understandably worried about these rising costs. So what do you say to Americans when it comes to comparing Medicare coverage plans? What steps can they take to help lower their out-of-pocket expenses?
Well, we have a cap that's available this year, so you don't have to pay too much out of pocket. At least it's capped at around $2,100. But ideally, you don't use all that money because you pick a plan that keeps your out-of-pocket costs down for prescription medications. And we actually dropped the amount that it costs to be on those plans this year. Medicare Advantage is less expensive this year than last year. Again, if you don't change your plans and customize them to your current issues, you're throwing money away. You are going to spend more for other types of Medicare just because there was a lot of fraud in the system. And although we're catching up to it, unfortunately, when people steal money from Medicare, we all have to pay extra into it. And by the way, I'm a Medicare beneficiary. I joined this year. I just turned 65. So I'm along for the ride.
Wow.
And going to the open enrollment period is a relatively seamless experience, a lot better than it has been in the past. So take advantage of all of our hard work.
And for some Americans, it can be overwhelming, this whole process. So what's your best advice for someone that might be intimidated, feeling confused by the process? Can they go somewhere for guidance?
Well, you ought to, I think, do these kinds of important decisions with someone else with you. So get a family member to join you, get a child to help you navigate the system. But if you really don't understand what's going down with the website, just call 1-800-MEDICARE. You've got a loving operator there. These guys get wonderful ratings for being able to communicate well these complicated ideas so that they can clarify any areas of confusion. The biggest mistake, however, the number one mistake you're going to make is not doing it before Sunday. That would be a really unfortunate error. And again, you're throwing money away.
It's a great reminder. Dr. Mehmet Oz, Centers for Medicare and Medicaid Services Administrator. We appreciate you joining us this morning. Thank you.
God bless you, Jen.
You too.